Hey, it's Jordan. I'm delighted to be joined by Michael Lighty. He is a fellow with the Sanders Institute and one of the foremost experts, I would say, in the country on healthcare, specifically Medicare, and has been one of the leading policy warriors for Medicare for all for years, even before Bernie Sanders popularized the term. Even when it was just lowly single payer without the proper term. I wanted to have you on because, you know, it's such a news suck, I call it. You've had the negotiations for months about the infrastructure deal and then the Build Back Better plan, which seems like it's about to collapse due to President Manchin and the Democratic Party pretty much not fighting for anything substantial. There's obviously been what's going on with the aftermath of January 6th and the commission, and there's a whole lot of things going on, voting rights, voter suppression. But quietly, in the middle of all this, President Biden and his administration are continuing a policy or an initiative the Trump administration had launched, which is a lot of complicated terms, which I'm sure we'll talk about it, but essentially seems like a backdoor privatization scheme to privatize Medicare. Can you kind of just, for the dummy, describe what was the Trump administration's plan, or what were they trying to do to try and add more privatization to Medicare, and why has the Biden administration continued that?
Yeah, thanks, Jordan. Great to be with you again. Essentially, it's called direct contracting. It uses the term direct contracting entities to describe these new, essentially kind of coordinating entities that are for profit, mostly, many private equity. And the idea of the Trump administration was to contract with providers and have the providers contract with these direct contracting entities to essentially manage care for enrollees. The trick is, and the reason that this is different from the existing private program within Medicare called Medicare Advantage, is that the enrollees don't have a choice. They don't even know, because the way the Trump administration set it up is it's between the direct contracting entities and their primary care provider. And initially, the Trump administration wanted to just auto enroll whole populations in specific geographic areas. So if you're in, Tennessee, your direct contracting entities would have a deal with your primary care doctor, and you wouldn't even know it. And all of a sudden, this entity is saying, hey, we're going to make sure you get the care you need. Well, very unlikely, because they get a much higher percentage of whatever they don't spend on care, they get to keep, even more so than the current private plans under Medicare Advantage. So it's a backdoor scheme that auto enrolls traditional Medicare participants and enables profiteering.
So, to me, we already have Medicare Advantage, which is wildly expensive, and it also denies a lot of claims for seniors on the existing Medicare program. So now it seems like they're trying to create another, I don't know if you would call this middleman or another bureaucratic system, essentially to create profit centers in the Medicare program. Do I have it right? Because it just sounds what you're explaining is an unnecessary additional bureaucratic layer that I mean, this is from the Washington Post story, but you already have 53 companies have signed up
That's
and
right.
been approved to administer the program. Shockingly, they're a mix of publicly traded healthcare companies and insurers and private equity startups. So it just seems like in the private healthcare system, we have this middleman that we've talked about before is completely unnecessary. The private healthcare companies, big pharma. This is just another middleman. Do I have that wrong?
You don't have it wrong. You have it right. And the fact is that this is a patient population that has chosen to stay in the traditional Medicare fee-for-service program. So the Trump administration, which the Biden administration is going along with, said, hey, let's come up with another way to capture these folks even though they're in traditional Medicare and they've chosen not to go into the private Medicare Advantage plan, let's come up with a scheme that gets you into a private program anyway. And the idea, see, because basically when it comes to innovation in Medicare, the policy gurus and based back by the industry believe innovation means privatization, means profiteering. So, in traditional Medicare, it's a public program, public good, but we want to still figure out a way to profit off those people, privatize that, innovate through those mechanisms. And so this is their way of doing that. And it is completely unnecessary. It's essentially bringing the practices of managed care into the traditional fee-for-service Medicare program. And as you say, it ultimately depends upon things like prior authorization for care, restricted access, referrals to within networks of providers rather than just full provider choice. And enrollees are, basically sold a bill of goods. They're told they're still in the traditional fee-for-service program. They're told they can go to any doctor, but their primary care doctor, who now has the relationship with this new third party, as you say, private equity firm or for-profit health plan, can now direct their referrals to the networks and reap the benefits. And in fact, doctors can make as much as 40%, according to that Washington Post story, over what they would get under traditional Medicare. So it's quite a scam, and enrollees this is all done without their knowledge or approval.
It's completely different, but it kind of reminds me of the Trump campaign. This came out in the New York Times. If you were a donor and had signed up to donate to his campaign, there was this little clause, and you can't read it, that you were automatically re-enrolled and re-enrolled and re-enrolled at higher amounts than you donated the first time. I mean, it's not the same thing, but it kind of makes me feel like there's some invisible automatic trigger against people's will, particularly seniors. I mean, God bless our older audience, but a lot of them are on fixed incomes. So they're not making, they're not being enriched by Social Security or Medicare, that they would be essentially against their will hoodwinked or in a scam process into this process that would it even provide them better services or more services, or this is just again a way to further commodify health Medicare and healthcare and give doctors and other healthcare companies more money?
There's no reason to believe, Jordan, that this is going to improve the quality of care, because the fact is these enrollees in traditional fee-for-service Medicare have a primary care doctor that's coordinating their needs, and they have choice of specialists. They can go to any specialist. They can get the tests they need already. There is no advantage, so-called, to another entity coming in there and directing referrals, deciding which tests are appropriate or which tests aren't. There's no value to that, because this new entity is taking over the role of the clinical decision-making of their primary care doctor. Who wants another healthcare bureaucrat incentivized by profit-making to start making decisions about what care you can access? And so there's no value to enrollees. Obviously there isn't, because the enrollees have no choice or knowledge of the change. So if there were real value, you would think that they would at least be upfront about it and try to persuade people. They're not bothering. They've enrolled 300,000 people in this program already. You've got 22 more entities up for approval. The claim by Department of Health and Human Services is they can't stop the program because they'll be sued by the private equity startups. But in fact, members of Congress have put forward a letter to HHS Secretary Javier Becerra, who does support Medicare for All, by the way, and told him, of course, you can end this program and you should do so immediately. And the fact that the Biden administration's Center for Medicaid and Medicare Innovation, which is the driver of this program, is headed by Liz Fowler, who, of course, came out. It was an health insurance industry executive and a primary author of the industry-friendly Affordable Care Act, is now driving this program. That's not a coincidence. And
Right.
someone who's dedicated to profit making off of healthcare, comes out of that sector, is in charge of innovation, tells you everything you need to know about what they consider to be innovation.